Okay, stroke code. Looking at this, we see that there's some loss of gray-white differentiation here in the left parietal lobe. It's kind of weird looking for a stroke, isn't it? Not very wedge-like. There is some loss of gray-white differentiation, but it's still some defined cortex. The flare helps us better see the extent of the abnormality. There's a lot of white matter abnormality here. And there is restricted diffusion. We see that the ADC values are dark, the DWI is light. So we're thinking, what is this, unusual looking stroke? This isn't a classic arterial distribution. So again, it was a stroke code. He had a CTA, and the CTA shows us this normal cortical vein here on the right side, but on the left side we see this non-enhancing cord. The SWI helps us because we can see that there's blooming where there should be this cortical vein. So once again, this is a cortical vein thrombosis with a venous infarction.